when we started PayZen, we saw an opportunity to really improve things for both patients and providers in the context of, increasing patient responsibility. We saw an opportunity to apply kind of the latest state of the art of fintech to this problem. When we looked at, existing solutions in the market, we saw a lot of legacy patient finance players and a lot of financial engineering, but not a lot of real engineering and technology. And we think by, bringing real technology and data science to patient affordability, we can have better financial results for the hospitals and a better experience, better access for the patients. Maybe Emily, give a little bit of background on UTMB as well.
Sure, thanks, Tobias. So I'm from University of Texas Medical Branch, and we are part of the UT system. We're a about 130-year-old academic medical center, and actually our main campus sits down here on the island. We have over 53,000 residents on Galveston Island, but we have grown quite significantly. We actually now have 4 campuses. We have 3 campuses on the mainland, in addition to, like I said, our main campus on Galveston Island. And we also have about 100 clinics across the region that offers both primary care as well as specialty care. And I would say, in addition to our focus on the patient's clinical experience, certainly it's very important to us that the patient also has a positive financial experience. And this has really been our focus over the last few years. And certainly, post-COVID or post-epidemic, when the economy really went belly up, we certainly started to see our bad debt numbers rising pretty significantly. And so we really are, I would say a year post-COVID, really putting a lot of effort into recovering from that. And, the estimates, point of service collections, and PayZen has really been part of this journey with us to help us provide that positive financial experience for our patients.
Emily, maybe you can cover the areas that you're most focused on, or kind of where your eyes at in the patient revenue cycle these days.
Sure. So I would just add 2 things really to what you said. You were talking about bad debt, self-pay balances rising, and when we look at our bad debt, we do separate out our unfunded population versus our balance after insurance. And really, even in the balance after insurance population, we've significantly seen, our bad debt increase. And so, you would almost say that that's low-hanging fruit. But to your point, a lot of these patients, want to pay their medical bills and just really, need a better option in order to do that. So I think it's important to kind of separate, or at least, from a data perspective, to look at, because you are going to have some unfunded population that's not necessarily going to have the ability to pay, but also a large population like your commercial population. And although those, the patient liabilities have gone up, you still have a higher, I guess, propensity to collect money from that insured patient. So I think that's important. And then on the slide before, we talked a little, or you showed about care avoidance. And I just want to make a point to where, in our organization, and I'm sure there are other organizations where, if you're not necessarily requiring the full amount up front, or if it's even, something where your physician or your surgeon is saying that it's an urgent type procedure, a lot of times, because we get in that, sort of back and forth there to, trying to financially clear it, patient isn't able to pay their full amount, but yet the surgeon wants to proceed with the procedure. And so it's not really even just care avoidance, but moving on to performing the procedure, providing the service without collecting that patient liability and then you're on the hook in the back end. And, obviously, and we all know your ability to collect that amount on the back end is much less than it is if you try and get it on the front end. So I think that's an important piece of the puzzle.
Maybe Emily, you can kind of cover what you're doing there and how it's performing.
Sure. Thanks, Judith. So, I did already mention this, but I would say over the last really probably year and a half, 2 years, a really big focus for even really before PayZen came into the picture, really big focus on improving our point of service collections. We are an Epic shop, and we do use the Epic estimate templates. There are areas where we automate estimates, others that, we will create and push out to MyChart for our patients. But certainly we're still making, outbound calls to our patients in order to collect ahead of time. Just, back to the poll. So we do require definitely a deposit before proceeding with a procedure. And really, this is where we were very focused, and I'll really say more in the outpatient procedural areas, because it's one thing to collect a copay, but really when you're getting into, an elective day surgery, radiology, cath procedure, any of those outpatient procedural areas where the patient's out of pocket is higher. I was very interested in being able to offer our patients a better option in order to pay those balances. And this really went, PayZen went very much hand in hand with what we were looking for in order to solve that pre-service option for our patients. And we've actually, been very successful. We have seen our point of service collections go up. We've seen our bad debt is trending downwards. And so this is actually proven to be, and we've actually gotten really positive feedback from our patients when they are able to utilize the PayZen option. We do ask for the full amount, up front, and then we go from there. So we work with our patients, but having this as, an option for them is really very beneficial. Now, I'll just, reiterate, and actually just based on those poll results, a lot of folks, are asking for a deposit, but not requiring it. And so that leads me to believe, just like we were doing, letting the patient proceed without collecting that full patient liability. And we certainly found that, a lot of times, because I think the theory is that you don't want to give up the insurance payment and lose volume, for a $1,000 patient balance or $500 patient balance. But we did a study here at UTMB, and more times than not, it showed that if we didn't collect the patient liability or our full rate, really, we weren't always covering our costs of those procedures. So I just think that's really important, to offer options for your patients to make sure that you can collect the patient liability upfront.
You guys are using both card and plans, and you still have in-house plans. Maybe you can talk a bit about your experience with the plans and kind of how the whole picture fits together at UTMB.
Sure. So we actually went live with our the back end, side first, and this actually was, I think, very beneficial for our patients. I think we send text messages to patients with a balance higher than $250. That's a guarantor balance. And we have, close to 10,000 patients, well, between the back end payment plans as well as the care card, but we have over 10,000 patients who have enrolled and are using these services. And, like I said, we've definitely seen our self-pay collections, patient liability collections go up. So this, and again, you talk about the technology. I think that, it's really easy for the patient, goes right to a link to their phone, that they can just click on, set up their terms. And you haven't talked about this at all, but, you know, if they need to skip a payment, they have the ability to do that. They can change their monthly amount. They have a lot of flexibility in creating those payment plans that I can't necessarily offer administratively, you know, from an Epic standpoint. So I think that's really, really beneficial for the patient. And again, I'll just mention the customer service. I have not had any complaints regarding, you know, collections or, you know, any complaints from a patient perspective.
You know, since with UTMB, we went through an RFP process. I think maybe Emily, from your words, kind of what are the things that you were evaluating the various vendors at, and kind of what were your decision criteria?
Well, I mean, certainly we wanted to improve our cash flow and improve our performance in patient liability collections. But really, even more important than that, I would say that the number one thing for us, or for me, is customer service. You know, certainly you would want to partner with a company, because really, at the end of the day, they're going to look at UTMB, right? So if, you know, they're getting, you know, these hard calls from, you know, a vendor, it's a UTMB balance. And so they're going to end up calling us. So customer service, I would say, is really at the top of the list. As far as, you know, anyone we would want to be partners with, we want to make sure that, you know, they're providing the utmost level of customer service to our patients. And then I would say, you know, which I mentioned before, just the flexibility and the automation. That also, I think, is very important.